Various regional leadership, including the Kavango East Governor, Police Regional Commander, traditional authority leaders, constituency councillors, and the general public gathered to exchange ideas on how to deal with the suspected food poisoning incidences once and for all. A representative from the Ministry of Health and Social Services gave an in-depth presentation on what suspected food poisoning is. Dr. Matthias Luemba also spoke about some of the various challenges hampering proper health care in the Ndiona area, which ultimately leads to death for many of the suspected food poisoning victims.
As it is, if we have emergencies, we have to, at times, probably where we have been maybe in the inland, and when we check our fuel level of the ambulance, the fuel level is so low. We have to, first of all, travel to Hundu, or we go to Divundu to fuel the vehicle before we can respond to emergencies. But if there's a gas station within our district, it's just a matter of 2-3 minutes. We go in, we fill our ambulance, and then we can respond to emergencies.
A number of people who attended the meeting also raised their concerns on how a toxicology report is never presented after a suspected food poisoning death. The former Deputy Prime Minister told the meeting that he contacted the Minister of Home Affairs, Safety and Security in March last year.
And I got a response in end of April now, beginning of April, which came from the police forensic laboratory. I can read this letter here. They said on the food poisoning case from Kavango East region, the results are not yet ready, as the Namibian Police Forensic Science Institute only received and installed new instrumentation in that regard about a month ago. The scientists first had to undergo training on the new instrumentation, and they are currently busy with the validation.
A local academic who attended the meeting says the suspected food poisoning cases in the area is a crisis that needs to be studied in depth.
Issue of this magnitude, of this occurrence, which is happening at frequent occurrences, that it needs a thorough study and investigation, an academic investigation, which will investigate every little details and issues. So this is not normal, and many people are seeking answers, and yet they cannot get the answers.